Let's just give 2 minutes for all attendees to come in. Okay, as people are coming in, probably I can start and say hello and welcome to everybody who's here so far. My name is Sumit Khimani. I'm from Smart Future. We are one of the organizers of this webinar called The Power of Good Sleep. And I can see some more attendees are coming in. So probably I'll give another 1 minute. Good. I see everybody saying good morning. Hi, everyone. Hello, welcome. I believe some people may take a while. It's a weekday morning, so we can probably, I can start to welcome, talk a little bit about organizers, talk about Dr. Jeeve here, and then others can join in later by the time Dr. Jeeve starts. So yeah, hi, like I said before, for those who are here, I am from Smart Future. We are a health tech company. We do quite a lot of stuff around remote patient monitoring. Sleep apnea is a very important subject for us, and we have done a lot of work in Singapore and the region. Actually in collaboration with Philips, I may say, and so obviously it's a very underdiagnosed condition, so we are very much concerned about it, and how we, more and more people can at least come to test themselves and know if they would have an issue. So today, I mean, just to kickstart this whole event is co-organized, if I may say, with Willis Tower Watsons. A lot of you would have received obviously an EDM from Willis Tower Watson, so I would like to thank Fiona and Aurelia, who have put in also a lot of effort to make this webinar possible. And going next would be to Dr. Jeeve. Obviously, thank you, Dr. Jeeve, for taking the time. I know how busy you are. I know you've got only 1 hour plus just for this webinar, so really thank you for that. And obviously for everybody else, Dr. Jeeve, very renowned ENT surgeon, 24 years of experience, and a lot, and I'll call him one of the best sleep specialists because of the focus and time he spends on sleep. And before Dr. Jeeve takes over, I just like to say to everybody, there will be 4 simple poll questions along the way, and Dr. Jeeve will give me the heads up and I will put it up. Please answer that. And I think based on the responses, Dr. Jeeve will continue the presentation. And secondly, Q&A. Please feel free to ask questions. We have put at least 15 minutes. We can stretch it to 25 minutes based on questions that are coming in. Sleep is definitely one of the most, everything is linked around sleep. I mean, I was just telling Dr. Jeeve, I'm having muscle spasms recently, and specialists say it could be because of sleep. So everything that you talk about, sleep is such a big, important pillar of health, and you're spending so much time on, sleeping and working on the desk. So it's something, many conditions could be linked to sleep, but today I believe Dr. Jeeve is going to focus more on very important, symptom called snoring, and also sleep apnea as a condition, which I mentioned earlier, which is very, very underdiagnosed. So I'll now let Dr. Jeeve take over. Thank you, everybody, and I'll be talking to you later. Thank you. Dr. Jeeve, please.
Thank you. Thank you, Sumit, and thank you, everyone, for joining this webinar. I'm speaking from my clinic in Mount Elizabeth, Novena, so you can see the clinic in the background. The clinic is running at the moment, so I apologize in advance if you hear any noises coming from patients or doctors or nurses. So I'm with the ENT clinic, and I will talk a little bit more about our clinic in Singapore later. We have 2 clinics, one in Mount Elizabeth, Novena, which is where I am at the moment, and the other is at Gleneagles Hospital. So I'm a ear, nose, and throat surgeon, ENT specialist, and I deal obviously with the whole gamut of ear, nose, and throat conditions. But one of the conditions which is obviously close to my heart is sleep, and in particular sleep disturbed breathing, and a condition called sleep apnea, which I will talk to you about. the lecture overview, I'm going to talk about sleep and its benefits, some of which Sumit has mentioned already. I'm then going to talk about snoring and sleep-disturbed breathing, which some of you may either suffer or you may be unfortunate enough to have a partner who has it, and their snoring or difficulty breathing at night may affect you. I'm then going to talk about this condition called obstructive sleep apnea, which may be new to some of you, may not be new to others, and how obstructive sleep apnea or OSA affects your heart. I'm then going to just briefly talk about how to identify obstructive sleep apnea, and very briefly, not go into too much details about how to treat the condition. So sleep is extremely important. As Sumit said, we probably underestimate the value of a good night's sleep. It's important activity for all mammals. And if you think about the proportion of your life that you spend asleep, it's actually probably the most important activity you do in your entire lifetime. The benefits of a good night's sleep are numerous, and it's really only recently that we are starting to realize what those benefits are and what the problems are with not only poor sleep, but poor breathing when you sleep at night. And this is an important thing that I kind of put up, which is basically a good night's sleep is more important than all the healthy diets you may want to try, the Atkins diet, intermittent fasting, all the exercise that you may want to undertake, all the meditation, the supplements that you may force feed yourself over the course of a day. None of that really matters as much as a simple good night's sleep. So how much sleep is enough? Hope some of you will, or most of you should recognize who this is, Napoleon Bonaparte. And he is quite famous to have said something that probably in this day and age is completely unacceptable in terms of gender stereotyping. But he was reputed to have said 6 hours for a man, 7 hours for a woman, and 8 hours for a fool. This is actually really an oversimplification, because in actual fact, the amount of sleep that someone needs is very personalized. So there is no right answer for one person. So there are some people who can function pretty well with less than 6 hours sleep. I think most people, it's in the range of 6 to 8. There are some people who actually do need about 8 hours of sleep to function optimally during the day. These are some individuals that I picked out and who we seem to know what their sleep patterns are like. This is Thomas Jefferson, the third president of the United States of America, quite famous for being the principal author of the Declaration of Independence. This is Sir Isaac Newton, famous for his laws of motion, and who reputedly pontificated on gravity when he saw an apple fall from a tree. And this, obviously, everyone knows, is Albert Einstein. There is good evidence to say that Thomas Jefferson only needed 2 hours of sleep a night, which is pretty impressive to function optimally. Sir Isaac Newton apparently only slept for 4 hours. But Albert Einstein, who we both regard, as we all regard as a true genius, actually required about 10 hours of sleep at night. So the correct answer is there's no right number in terms of the hours of sleep that you need to function optimally. You need what you need. What is the importance of sleep? So I'm just going to go through some of the important things that sleep gives you. So the first thing is learning and memory. And really, during sleep, your brain commits new information to your hard drive, if you like. So there's a consolidation of your memory. And in studies of people who slept after learning a task, they seem to perform better at that task after a good night's sleep. And I think this is important in the context of young children, students, that, what is really important after they, study at night is actually then to follow that up with a good night's sleep. So there's no point burning the midnight oil and spending lots of hours studying if you then do not follow it up with a good night's sleep. Sleep deprivation may also cause weight gain, and this is important. It affects the way we process and store carbohydrates and fats, and it alters the level of hormones in your body, in particular a hormone called leptin, which determines your appetite. And what I describe to patients is that if you are tired due to a lack of sleep, your body sometimes interprets that as having low sugar levels. And so you end up craving for calories, and you therefore end up overeating. And so in actual fact, having a good night's sleep actually probably reduces your craving for food, for carbohydrates, for sugars, and sort of modulates your appetite so you don't actually end up gaining weight. And this is something we see in a condition we'll talk about called obstructive sleep apnea, where when patients don't sleep very well, they tend to be put on weight. And when you treat the obstructive sleep apnea, but don't even actually increase their level of activity or any other forms of physical exercise, they just generally lose weight because their appetite or satiety center is reset, and they actually end up not wanting to eat as much. There's also a safety issue. So obviously, if you do not sleep well at night, you tend to make mistakes. These lapses may cause falls, and of course, an increase in road traffic accidents. This is a fairly famous saying now these days, because those of you who watched the Netflix movie Don't Look Up will remember that this was quoted in the Netflix movie. It's a very funny, quaint saying that I want to die peacefully in my sleep like my father and not screaming in terror like his passengers. This is attributed to an American humorist called Jack Handley. And I tend to use this quote because it sort of tells you the dangers of sleep apnea, sleep deprivation, and a poor night's sleep, that you may cause road traffic accidents. And when you do cause that road traffic accident, you'll be asleep at the wheel, so you will die fairly peacefully, but unfortunately, none of your passengers will. What are the other important reasons for sleep? So one is mood. Sleep loss may cause a lot of irritability and impatience and inability to concentrate. And so if any of you have work colleagues who are irritable or impatient, perhaps it's nothing personal, but it may be that they're just not sleeping very well at night. And then finally, to the real meat of the subject, that sleep disorders can affect your cardiovascular health. And so it is linked to high blood pressure, to an increase in the stress hormone levels. It can cause irregular heartbeat, and we'll come to talk about a condition called atrial fibrillation, which is very closely associated with sleep apnea. It can cause heart failure. More worryingly, it can cause sudden cardiac death at night. People go to bed and don't wake up the next morning. It increases the risk of stroke as well as diabetes. And then finally, I think in this day and age, when in the throes of a pandemic, we think about immune function and how some people who succumb to COVID tend to have a worse outcome than others. And we all know that this is related to the immune system and how it responds to infections. And sleep deprivation affects your immune system. So not only does it affect your ability to fight infections, but we increasingly know that the immune system is also important in destroying cancer cells. So there's this concept of immune surveillance. So the immune system looks for cells that have become cancerous and destroys them. And if you have sleep deprivation that reduces your immune system, you're theoretically at a higher risk of developing cancers. We know that we use the immune system in the form of immunotherapy to treat cancer. So if you look at sleep, and I get quite excited about this, that the amount of things that it affects is so vast that it's often underestimated at how important a good night's sleep is. I'm going to talk about snoring and sleep disordered breathing, which is really the most common sleep disorder that we see. And amongst young people in their 30s, about 20% or 1 in 5 men will snore, but only 1 in 20 women will snore. So snoring in the young is more common in men than women. But as women go past their menopause, they catch up with the men, and about 60% of women and men will snore after the age of 60. So if you look at snoring, so a lot of people snore. It's very common. In fact, at some ages, you could say that everyone snores to some extent. But there is a small subset within snoring, which is this condition called obstructive sleep apnea, which I'll come to talk about, where snoring is actually associated with more serious problems where people stop breathing and there's a drop in oxygen going into the body. As a side, there is a small subcategory as well called central sleep apnea. Sorry, that shouldn't say OSA, it should say CSA. And central sleep apnea is where people have a problem in the neurology or the circuitry that governs breathing at night. And they can actually stop breathing, not because of an obstructive cause, but because their respiratory drive to breathe actually somehow ceases at night. Central sleep apnea is very uncommon, but we do see it in patients. So what is obstructive sleep apnea? So it's a condition where people stop breathing for 10 seconds or more, or breathe very shallowly. And actually breathing very shallowly or under ventilation is called hypopnea. Complete cessation of breathing is called apnea. It comes from the Latin term. When this happens, the oxygen levels in your blood drop. And when the oxygen levels in your blood drop, your brain then says, I'm not getting enough oxygen. So it increases the heart rate. And so your heart rate goes up, your pulse rises. And this is all in the context of someone who's completely asleep at night. So sometimes I see patients who at night, because they have sleep apnea, their oxygen levels drop and their pulse rate goes up to more than 100. What then happens is the patient then has an arousal and they wake up and they start breathing again normally. And I'll just show you in a little while a short video from the Mayo Clinic, which describes this. And what is important is the two aspects. One, there's an obstruction of breathing, a drop in oxygen, a rise in pulse. And then to overcome this obstructed breathing, the brain wakes up the patient, and therefore the patient has an arousal. So there are two problems. One is a drop in oxygen levels. And the second thing is frequent arousals. So these are called micro arousals. So throughout the night, patients are waking up. And as a result, they get very fragmented sleep.
When you breathe, air travels down your throat, through your windpipe, and into your lungs. The narrowest part of that pathway is in the back of your throat. When you're awake, muscles keep that pathway relatively wide open. But when you sleep, those muscles relax, allowing the opening to narrow. The air passing through this narrowed opening may cause the throat to vibrate. That causes snoring, which many people experience. But in some people, the throat closes so much that enough air can't get through to the lungs. When this happens, the brain sends an alarm to open the airway. Most often, this is associated with a brief arousal from sleep. The brain quickly reactivates the muscles that hold the throat open. Air gets through again, and the brain goes back to sleep. This disorder is called obstructive sleep apnea.
So that's a very nice video from the Mayo Clinic, just describing what obstructive sleep apnea is. But how does obstructive sleep apnea affect your heart, and how does it affect your health? So mild obstructive sleep apnea actually doubles your risk of developing high blood pressure. And this is based on a large study in Wisconsin called the Wisconsin Sleeps Cohort Study, which followed a group of men with obstructive sleep apnea and found that after some years, they all develop high blood pressure. What I actually see in my clinical practice is you get a lot of patients who actually have high blood pressure at a very young and early age. And what you find is no one has ever asked them about their sleep and snoring at night. And so a lot of these people have actually undiagnosed sleep apnea. And because it's undiagnosed, it gets untreated, and they then develop high blood pressure at a very early age. If these patients were diagnosed with obstructive sleep apnea in early age and treated, you'll find that very few of them will go on to develop sleep apnea. So this is something that we've started to realize, that you're increasingly seeing a lot of people at a young age having high blood pressure. And one of the causes which are untreated is underlying obstructive sleep apnea. Men with moderate sleep apnea are twice as likely to suffer a heart attack. And there's also an increased risk of sudden death in sleep. And this is quite tragic, where people go to bed and at night they have a massive heart attack and therefore die. And so they go to sleep and they effectively die in their sleep. This is not due to them stopping breathing or choking at night. but it's because they've suffered a heart attack, which is somewhat silent because they're asleep. People with sleep apnea are more likely to suffer a stroke. The reasons for this are very interesting. It's thought to be related to the noise and sound and vibration of snoring in the neck, causing minor damage to the main arteries, the carotid arteries going up, supplying blood to the brain. And due to that vibration and the damage to those arteries, over time, those arteries tend to narrow and therefore can lead to a stroke. Sleep apnea, as I mentioned earlier, is also associated with abnormal heart rhythms. And there's something called atrial fibrillation, where part of the heart, which is the atrium, fibrillates. And so these patients, when you feel their pulse, they have a very irregular pulse beat. And this, if untreated, can result in heart failure. And heart failure results in building up of fluid on the lung and shortness of breath. And so in patients with atrial fibrillation, it's very important to identify if they have sleep apnea. And if they do have sleep apnea, it's very important to treat it. So I get a lot of referrals from cardiologists who have patients with atrial fibrillation, and they've treated these patients with atrial fibrillation. They are now in a normal heart rhythm. But to maintain them in a normal heart rhythm, it's fairly important to identify sleep apnea and treat it. And finally, we know that sleep apnea causes insulin resistance, and we know that insulin resistance, body's inability to absorb sugar, can result in high blood sugar levels, which is really what diabetes is. So sleep apnea, very closely related to diabetes. In fact, the World Diabetes Association recommends that all diabetics should have a sleep study to exclude the possibility of sleep apnea. So there you have it, obstructive sleep apnea, right in the center of multiple medical problems, high blood pressure. And it's very often, as I said, high blood pressure is diagnosed, but we don't find the underlying sleep apnea. Heart attacks, patients who have heart attacks should have studies to look for obstructive sleep apnea. In later age, if sleep apnea is not treated, some of these patients in their later years may develop a stroke. Heart failure, as I said, and abnormal heart rhythm or atrial fibrillation, very closely related to obstructive sleep apnea. And finally, diabetes. These are all the common medical conditions we see. They're the common killers. And right at the center of all of them is obstructive sleep apnea. So how can I tell if my partner has sleep apnea? And it's important to distinguish between simple snoring and sleep apnea. And of course, what your partner relates is not really the optimum way of deciding, but there are some telltale signs. So snoring is noisy. It's disruption of airflow, but breathing tends to be maintained, socially disruptive. People don't like it. But with sleep apnea, it can at times be silent. So it's not always noisy. The airflow and breathing ceases or is obstructed. There's often choking, or there may be even periods where there's a complete cessation of airflow. So there's no audible sounds of breathing or snoring. And then patients have what is known as a crescendo snore, where they go, and that's when they have that arousal that opens up the airway and they start breathing again. What I find with patients who have sleep apnea, when their partners come with them to see me, they tend to be more concerned rather than annoyed at the snoring. So when you know that a partner is concerned at this abnormal breathing pattern at night, then you start to think this is not just simple snoring, but it is possibly sleep apnea. So how can you tell if you have sleep apnea? There are some symptoms. So you wake up feeling unrefreshed. So you feel that even if you've slept a sufficient number of hours, you feel groggy when you wake up. There's excessive daytime sleepiness during the day. So if you are an office worker and you work at your desk, you may find that particularly after lunch, if you're looking at something, you tend to fall asleep very easily. Some patients, they've compensated for this. So they've sort of built in short siestas after lunch to help with that. patients with sleep apnea tend to have early morning headaches, and that's due to the poor oxygenation during the night that gives them a little bit of a headache in the morning. They have poor concentration. They tend to be irritable, as I said, poor memory. So they tend to forget things very easily at a very young age. They tend to have reduced interest because they're tired all the time, don't have much hobbies. There's also an association with a lack of libido and sexual impotence due to significant obstructive sleep apnea. So what should you do if you think you have obstructive sleep apnea? So I think one of the useful things is always ask your partner what they think about your sleeping patterns at night. Sometimes partners tend to be very sensitive about discussing these things, so they may not want to say, particularly women asking their husbands, about whether they snore. Some husbands may fear retribution if they were absolutely honest about the severity of the snoring. You may want to use an Apple Watch or a Fitbit or such apps such as Cardiogram to track what your sleeping is like at night. There are some apps on smartphone freely available, things like Sleep Lab, which you can get. And there are obviously various screening questionnaires, a Berlin questionnaire and an Epworth sleepiness scale. I must say at the end of my talk, there'll be a QR code that I want you to scan, which has a very nice, simple screening questionnaire about whether you have sleep apnea or may have sleep apnea and whether you should have a sleep study. So there are lots of apps, and this is the Sleep Lab. This is a Fitbit. The Fitbit gives you some information. They're not very accurate, but they do give you an idea of the quality of your sleep. It gives you how many hours, percentage of rapid eye movement sleep, deep sleep, light sleep. And it can have a very rudimentary way of scoring your sleep. Obviously, in an ENT clinic setting, we would assess for sleep apnea in a more thorough manner. So the first thing we undertake is an inspection of the upper airway to look for any obstructive causes that may cause sleep apnea, such as a deviated septum. So that's where the cartilage of your nose is bent to one side, large turbinates that may cause nasal obstruction, large tonsils or large tongue base. This is a view that we get of the throat with nasal endoscopy. These are your vocal cords. That's the airway. This floppy little leaf thing is called the epiglottis, where food and fluid go down the back here, air goes down through here. This is the back of one's tongue. And this bulge here is actually an enlarged tonsil. So large tonsils may be one of the causes of obstruction. We would then investigate for obstructive sleep apnea using a variety of methods. This is one form of what we call ambulatory sleep study. These are home sleep studies. They mean that they can be done at home in a more natural setting. And they give you very useful information. So in this sleep study system, it tells you the level of snoring, which is the orange lines, which in this patient isn't very severe. It tells you also the position that this patient sleeps in. And then it gives you a readout of the oxygen saturation for this patient and the pulse. And finally, it tells you the stages of sleep. So they were awake, then they fell into light sleep, deep sleep, then light sleep, deep sleep, light sleep. And then at this point, somewhere towards the latter half of the night, this is where the patient goes into rapid eye movement sleep. So rapid eye movement sleep is dream sleep. That's when your muscle tone relaxes. All the muscles in your body relax. You start dreaming. And if you actually were to look at these patients during rapid eye movement sleep, you will see that their eyeballs behind their closed eyes will be darting about. And because their muscles are all relaxed, then things tend to collapse and obstruct. And you can see in this patient, when that happens, the oxygen levels start to drop. So they start to drop, and as the oxygen levels start to drop, you start getting this rise and spikes in the pulse. And so this is a classic sort of example of what happens during obstructive sleep apnea. The patient is in rapid eye movement sleep, so really relaxed sleep, oxygen levels drop, heart rate goes up, and you can see there's a slight increase in the severity of snoring, but not a huge increase. So what can be done? So the treatment of sleep apnea really depends on its severity and the cause of the obstruction. So this is a patient's throat, and for those of you who are not familiar, so these are the teeth up here, and that's the tongue here. And I think you can see what the obvious problem is, that these two large golf balls sitting in the back of the throat, and these are tonsils. And these are obstructing tonsils. We sometimes call them kissing tonsils because the tonsils are almost meeting in the midline. Very large tonsils, a very common cause of obstructive sleep apnea, both in children and in adults. And when you have large tonsils causing obstruction, one of the simple methods of addressing the obstruction and addressing the obstructive sleep apnea is just to undertake tonsillectomy, which is an operation to remove the tonsils. Oral appliances may help. So if you look at this diagram here of someone lying on their back, so this is their nose, this is their upper teeth, lower teeth, this is their palate, and this is the back of their tongue. Some patients have a situation where the lower jaw, the lower teeth sit too far back, and as a result, the base of tongue sits too far back and collapses onto the back wall of the pharynx or throat. And in these patients, if they have sleep apnea, what you can do is you can actually get them to wear an oral device, an oral appliance, and the oral appliance actually will draw the lower jaw forward in this way and prevent them from having that tongue-based collapse at night. And then finally, the gold standard of treatment for obstructive sleep apnea, particularly severe obstructive sleep apnea, is the use of something called a continuous positive airway pressure, or CPAP. And what this is it's a little mask that sits onto the nose. It's connected by a hose to a little machine. And what this machine does is it generates air, not oxygen, air at a slightly higher pressure that goes through the nose and literally splints open the airway so that patients can actually breathe better. It is a very sophisticated piece of machinery. So it's got an auto titrate setting. So what it does is it only pushes air at a pressure enough to open the airway. And once you start breathing again, it doesn't keep increasing the pressure. So it is actually very comfortable to use. And it sorts out sleep apnea extremely well. When I describe this machine to patients, they always look very alarmed. But when they go and have a trial, and most companies will allow you to try it before you purchase it, you will find that these patients come back and report a significant improvement in the quality of their sleep. And it's a life changer. So these patients almost literally never leave home without it. So when they go on holiday, they take it with them. You can get portable machines that you can use on flights, long-haul flights. In fact, patients of mine who do use it on flights say they sleep better on flights with the machine than they did previously. It's highly effective. These machines are very robust. They last 5 to 10 years. There's a little bit of servicing that's required, but they're very effective. And often when I send them to give them to patients, the bed partners are extremely happy, because the snoring completely disappears. And obviously their partners are happier because they have a better night's sleep. In fact, some people, some wives tell me that they get worried. They wake up in the middle of the night, they cannot hear their husband snoring, so they have to check that their husbands are actually alive. I'm just going to go through some simple case studies that will be of interest. So the first is a 36-year-old HR manager who noticed increased snoring over the last few years as he gained weight. He was sleepy at work and had to compensate by drinking a lot of coffee and chewing Nicorette. His blood pressure was raised at 139/93. I think those of you who know blood pressure measurements in Singapore, the guidelines are you're hypertensive if your blood pressure is above 135/85. It varies in different countries. Some countries 140/90, in the US 130/80. But this patient was hypertensive. And when I did the nase endoscope, you can see this is the view, very similar to the view I showed earlier. So that's the epiglottis, that's the tongue base, but this is the palate, and there's a considerable amount of collapse at the level of the palate, and as well as the level of the tongue base. There's a little bit of collapse in the airway. And when we did the sleep study, he had severe sleep apnea. And so with severe sleep apnea, as I told you, the gold standard of treatment is CPAP, and we started him on CPAP treatment. And at 6 months review, he was very happy with CPAP. He was compliant. He was traveling with the machine. His wife was happy. She could sleep undisturbed. His performance at work was better. He was more alert. And interestingly enough, his weight started to go down because he was sleeping better. He wasn't craving those calories. He was much more energetic during the day. And so, he'd feel energetic enough to take the stairs when in the past he used to take the lift, and his blood pressure then normalized. So an amazing response just with treatment of obstructive sleep apnea. Second case study, 47-year-old CEO, travels a lot, snores loudly, had nasal surgery some years ago for a blocked nose, but this didn't help his snoring. And this is often something we see, that nasal surgery may restore nasal breathing, but it may not significantly affect snoring. He was tired and lethargic, very irritable, and he was smoking to keep himself awake. He had gained weight recently. Was probably craving the calories, and he wasn't keen on surgery, and he refused to consider treatment with CPAP. When I did the sleep study, he had moderate obstructive sleep apnea, which was worse when he was lying on his back. So you remember that picture I showed earlier, someone lying on their back. You start to think, is his tongue base, is his lower jaw falling back on itself? And actually, in fact, when I did put the scope on in him, you can see, once again, just to orientate, that's the epiglottis, that's the airway, that's the back of tongue. And you can see it's pushed quite a way back. So there's very little air there. And what I get them to do, these patients, I get them to sit in clinic when I have that scope in their nose, and get them to bring their jaw forward. And when he brings his jaw forward, you can see what happens is the airway opens up nicely over here. And so with this patient, because he wasn't keen on surgery, he wasn't keen on CPAP, he had moderate obstructive sleep apnea, it wasn't severe, I got him an oral appliance. And this oral appliance essentially is worn at night, so you don't have to wear it during the day. You wear it at night, brings your lower jaw forward, and it overcomes the sleep apnea. So when I saw him at 6 months, he was using the splint daily. He was using it on flights, obviously less intrusive, easy to do. He was feeling more rested, and he was smoking less, and also exercising more. So I'm not going to talk too much about the treatment beyond what I've already said, except to say that there are 3 modalities of treatment in general. So there is surgery for those who have very obvious obstructive causes. There is the use of an oral appliance for a very specific subset of patients which have a large tongue base and a very small, receded, retrusive lower jaw. And finally, a CPAP machine, which is good for everyone, but obviously it does take some getting used to, to use this machine to sleep at night. Now, so I hope you've been listening, because I just want to do a quiz, and I hope we get some responses from people. Questions aren't too hard, and I will read the questions, and I'll get Sumit to launch the poll. So first question, sleep apnea only affects overweight and obese people. So if you're thin, you are unlikely to have sleep apnea. Would you say this is true or false? Let Sumit decide when to close the poll, when he thinks enough people have made the choices.
I will do that. It's moving right now, so as soon as it stops.
Thanks, Sumit.
People answering it. Thank you. Okay, I will stop here. There's some people answering still, but yeah, we've got a good number. So I'll end the poll now, and you can take over, Dr. Jeeve.
Yeah. Okay, so false, excellent. So this is very good. Most people recognize that weight in itself and obesity is not the main deciding factor. So I will close the poll. And yeah, so it is false. Between 20 to 40% of patients with sleep apnea will actually have a normal weight. So just because someone looks slim and thin, they may have sleep apnea, and it may be related to obstructive causes. So they may have large tonsils, or they may have tongue-based collapse and stuff like that. So these patients actually should be seen by an ENT to just assess the upper airway. So next question. Patients with severe sleep apnea may stop breathing at night and die. True or false? So a bit of a tricky question. People with severe sleep apnea may stop breathing. They'll stop breathing at night and not start again and die. Is this true or false?
Probably another 10 seconds. There's still people answering.
Okay.
Okay.
Okay, that's interesting. So most of you feel that this is true, that people with severe sleep apnea may stop breathing at night and die. So if we close the survey, I'll give you the answer. And the answer is actually false. So it's a common myth that people who have severe sleep apnea will die from breath cessation, or they'll have a respiratory arrest. In actual fact, and what I did say in my lecture is these patients with severe sleep apnea actually have a risk of having a sudden heart attack at night. And so it's not that they stop breathing and die, but they actually have a heart attack. And as a result of a massive heart attack, die. The reason why I put this up is because there is this myth that goes around and people get highly anxious. And some of it is probably perpetuated by medical professionals saying that, oh, you have very sleep apnea, and to scare their patients into getting treatment, they may say, oh, you need to do something about it because you stop breathing at night and die. But that's not true. What actually happens is every time you stop breathing, no matter how severe it is, there'll be an arousal when you wake up. But in 2013, in America, the American Journal of Cardiology, they published a study that showed that people with severe sleep apnea tend to have a higher rate of sudden death at night. And most of these people who have sudden death at night often happens at home. They end up having an autopsy, and most of these people seem to have had a heart attack, a silent heart attack at night, but they did not have a respiratory arrest. It was more a cardiac arrest. So no matter how severe, patients often start breathing again when the brain is aroused. However, as I said earlier, sudden cardiac death at night is increased amongst patients with sleep apnea. So difficult question, so I will forgive the 79% who got it wrong. Next question. Sleeping on your side helps with snoring and sleep apnea. True or false?
I'll give another 5 seconds. Okay.
Good. So 77 people say true and 23% said false. This is good. These questions are discriminating. And the answer is kind of true. So the reason why I say kind of true is that lying on your side certainly helps with snoring. And some patients have sleep apnea, which is called supine sleep apnea. So they only have sleep apnea when they're lying on their back. And that's principally because what I said earlier about the base of tongue or the jaw falling back. But that's not always the case. So there are patients who have sleep apnea, who are actually have sleep apnea in all positions. So unfortunately, I've sort of accidentally revealed question number 4, but I will ask question number 4 anyway. So sleep apnea rarely affects children, true or false? Hopefully none of you saw the answers.
Okay, another 3 seconds. Okay.
Ooh, wow, okay, so it's kind of a close. So 60% say sleep apnea rarely affects children, and about 40% say it does. That's good. That means people didn't see the slide answers earlier. So it's false. So sleep apnea does actually affect children, and about 1 in 10 children have sleep apnea, and it's often due to large tonsils and adenoids, and surgery to remove the tonsils and adenoids is curative. So actually treating sleep apnea in children, obstructive sleep apnea, is actually very, very gratifying, because these children tend to come in with large tonsils and they have large adenoids, so they tend to have a blocked nose. They have what is called stertorous breathing. So if you hear them, they sound kind of as if they've got something choking them in the back of their throat. When they sleep at night, you will notice that these children sleep in a kind of a head extended position, as if they're trying to open up their airway to breathe. And they tend to be very restless, so they toss and turn. A few telltale signs about children with obstructive sleep apnea is that they tend to have a little bit more bedwetting. So if you find that children, coming up to 4 to 5 years old are still bedwetting, you may want to think whether they have sleep apnea. And another common effect of obstructive sleep apnea in children is something called night terrors. So they just wake up screaming without any real reason. People think it's just a nightmare, but these are night terrors and they're associated with obstructive sleep apnea. So about 1 in 10 children have it. Sometimes it's very easy just from the history, and patients, I usually ask parents of these children to take a video of them sleeping, and I can assess just from the way they breathe, their posture, the fact that their mouth is open, their neck is extended, that they may have sleep apnea, and then I confirm them obviously with an examination. But in some children, you can actually do a pediatric sleep study to establish if they have sleep apnea. It's very interesting as a side. Children with ADHD, with learning difficulties, if they do have, on top of that, sleep apnea, they tend to end up having a worse outcome. So with children with ADHD, which attention deficit and hyperactivity disorder, it's important to establish if they have obstructive sleep apnea and treat it, because they tend to do better. This is just a photo from Charles Dickens' Pickwick Papers. Joe the Fat Boy, who was a character who was slow and lethargic, fat boy, and it is a classic example of a child with sleep apnea. And if sleep apnea in young children is very severe, they can develop right heart failure, and so it does actually affect the heart. And Joe the Fat Boy probably had obstructive sleep apnea, and when obstructive sleep apnea was first described, it was sometimes called the Pickwickian syndrome, after the Pickwick Papers. So that concludes my talk. I hope you've enjoyed it. The next slide has got a code that I want you to scan. It'll take you to a website where you can do a sleep apnea risk assessment. And I think this is very useful. So if you have your phone, you can scan it. Whilst you're doing that, I'm just going to play a little video, which someone sent me. It's from TikTok, so it's public domain. And it's actually a very nice, kind of touching video. Actor called Joe Kukadas, Malaysian.
Mrs. Lee, I believe you have some words to say about the dearly departed.
I'm not going to sing praises for my late husband. Not today. Neither am I going to talk about how good he was. Enough people have done that here. Instead, I want to talk about some things that will make some of you feel a bit uncomfortable. First off, I want to talk about what happened in bed. Ever had difficulty starting your car engine in the morning? Well, that's exactly what David's snoring sounded like. But wait, snoring wasn't everything. There was also this rear end wind action going on as well. Some nights it would be so forceful, it would wake him up. What was that? He would ask. Oh, it's the dog, I would say. Go back to sleep, dear. Oh, you might find this all very funny, but towards the end of his life, when his illness was at its worst, these sounds indicated to me that my David was still alive. And what I wouldn't give just to hear those sounds again before I sleep. In the end, it's these small things that you remember, the little imperfections that make them perfect for you. So to my beautiful children, I hope one day you too find yourselves life partners who are as beautifully imperfect as your father was to me.
Thank you, Dr. Jeeve. Really very engaging, very interesting as always. I just wanted to, I know you have an appointment in 20 minutes. So we had some questions people have asked. So I thought I'll take an opportunity, just ask those. Some of the ones I will choose. I sleep more now because of work from home, but I feel more fatigued than before. Is this an indication of OSA?
So it is clearly one of the indications. If you're actually sleeping long hours, but you feel more tired, it is obviously the only way to really be sure is to get yourself a sleep study, because that's the only way to be sure. But obviously, it's worth asking, as I said, asking your bed partner. Is there disturbed breathing? Is there snoring? But the fact that it sort of happens more from work from home, may not have happened before. You start to wonder whether there's some issues with sleep hygiene. So one of the problems about work from home is people's routine gets disrupted. So you end up working longer or doing work at night. In the past, you would leave the office, leave your work and come home. It may be related to just the nature of sleep hygiene.
Thank you for that. So, and a question I'm just going to modify, a few people have asked. So I know you said surgery is an option, CPAP is an option, mouthpiece is an option. Are there any other, would you recommend lifestyle changes or any other traditional therapies that may also be there to solve this in the long run?
Yeah, so actually it's interesting. One of the things that probably I should have mentioned is obviously weight reduction, right? So, significant weight reduction would be one way of getting rid of sleep apnea. Not always easy to do. In terms of, there aren't many traditional remedies that I'm aware of. And in selected patients, there are certain drugs that people use. They tend to be stimulant drugs like modafinil. It's quite widely used in the States, where patients with very severe sleep apnea are given a drug called modafinil just to keep them awake. But it's not common practice, certainly in Southeast Asia.
Okay. Thank you for that. And I know in chat, a lot of people had said, so I remember somebody asking earlier about, they were not able to get used to CPAP. And I think that's a very common thing that comes in. So because they felt the airflow was a bit forceful, And any recommendation? How do you force your body to get used to CPAP? Is it just force your way through and sleep with it, or other?
Yeah,
any
so I think the thing to do is obviously to make sure that you don't have any nasal blockage, because one of the things you want to do to optimize CPAP is to make sure you don't have a blocked nose. And it's very useful to just have an ENT assess that you don't have an obvious cause for a blocked nose. For a lot of patients, it just involves using a nasal spray, and there are lots, without advertising anyone, but there are lots of nasal sprays that you can use to decongest the nose. And if you do that, you can then find that CPAP is more tolerable. But to some extent, it is persisting for at least a week or so before you give up.
Okay, got it. And again, I'm just modifying. Few people have talked about REM, about deep sleep, and I think they feel they're not being able to go into deep sleep, or and then so they have obviously concerns, and they think it's bringing, let's say, high risk of dementia and Alzheimer's in later part. So it's more is, I think I'll probably ask a question. Just first is diagnosis of whether I'm going into deep sleep. So that sleep test you recommended, is that able to cover that, the level 3 at home? And then secondly, how do you make your body go into deep sleep? One is sleep apnea, if I have the CPAP device. Other ways, lifestyle or something to make your body go. I'm just guessing, no alcohol before going, like that could be one
actually,
way.
that's probably the most common cause. But basically, the sleep studies, just to take the two questions. So most of the sleep studies, even the level 2, level 3 sleep studies, will be able to show you some accurate information of sleep stages. I mean, even your Fitbit sort of gives you some information about REM sleep. What can you do to make sure you have good REM sleep is obviously to avoid stimulants, like coffee and stuff too late in the day, reducing caffeine. In fact, I would suggest no caffeine after midday. And tea has caffeine, so does green tea. And then obviously alcohol. So those are the things that are going to affect your REM sleep. What you tend to find is that patients, certain periods of stress, they may have a few nights where their REM sleep is poor, and then they have what is known as a catch up. So the following night, then they have more REM sleep than normal.
Okay. I know there's one user, Henry. I thought he has a question which he could probably visit you and ask, but I'll still ask. So his question is, heart rate dropped actually below 40 in sleep, and it happened 4 to 5 times, probably opposite than probably what we see in the test for sleep apnea. So what about that? Is it something to do with sleep apnea? Second question of what he said is getting up in the night quite a lot of times for, to go to the toilet, for example. So is that, I mean, with these two conditions together, would you say it's something related to apnea, or he said bladder?
Yeah. So actually, low pulse rate, which is bradycardia, so their pulse rate goes low, is not actually associated with obstructive sleep apnea. And there are a lot of people who are extremely fit who may have very low resting pulse. Obviously, the correct answer is see your cardiologist and have it checked. And often they do a 24-hour pulse monitor just to make sure there are no irregular heartbeats. But the interesting question about waking up to pass urine at night, it's a term we call nocturia. So you wake up several times at night to pass urine. Now that is associated with obstructive sleep apnea. So one of the things that I ask patients routinely who I think may have obstructive sleep apnea, I ask them if they wake up several times at night to pass urine. Now, obviously, frequency of passing urine is also associated with diabetes. So people who are diabetic tend to pass more urine as well. So you need to be careful as to, is it that they are passing large amounts of urine, more than normal, or is it that they are actually passing normal volumes of urine, but they're just waking up at night to pass urine? And the reason for that is the nature of sleep apnea and the levels of hormones that changes during the night. There is a hormone called ADH, it's the antidiuresis hormone, that prevents or reduces urine production. And because there's a disruption of that hormone, they end up producing more urine at night and therefore having to wake up to pass urine. So it's a very useful question. Thank you.
Thank you. Just last two questions, probably. A lot of people I say, saw in the chat talking about mouth breather, that they're mouth breathers. So obviously they're first of all linking whether it's something to do with sleep apnea. Second, somebody even said a very nice, funny comment. Can I tape my mouth to prevent, me from having sleep apnea? But so I'll let you talk about it, and also CPAP for mouth breathers. I think that could be something. And as a question I'm asking. Yeah.
So it's very interesting. Those of you who are really interested in this, I would recommend a book by James Nestor, Nestor. It's called Breath or Breathe. But it's basically, he talks very extensively about the health dangers of mouth breathing and how we have all become a race of mouth breathing people. Due to nasal obstruction and failure of the upper and lower jaw to develop. So mouth breathing is actually probably unhealthy. And what happens when you mouth breathe at night is because your jaw folds open, your lower jaw tends to drop back, as does your tongue base, and it contributes more to snoring and sleep apnea. So actually closing your mouth actually brings the tongue forward and actually helps with sleep apnea. Now, obviously, if you've got a very blocked nose, taping your mouth shut at night may not be a good thing because you are relying on your mouth to breathe. But there are some people who believe that a lot of mouth breathing is habitual, and there are certain tapes available. One is called SomnoFix, where you can get them on Amazon. You can tape your mouth shut and you can train yourself to breathe through the nose. Works for some, doesn't work for others. The other thing you can do is something called Breathe Right strips. These are available from Johnson & Johnson. They go over the arch of the nose. You can sometimes see rugby players wear them when they play games. That helps increase nasal patency and reduce mouth breathing. As a separate question, what do you do about patients who mouth breathe, who then need a CPAP machine? It's very interesting. A lot of CPAP vendors or sleep technician specialists, even if patients do mouth breathe, they tend to still use a nasal mask CPAP because they feel that if you put positive pressure into the nose, it actually encourages the patient to breathe through the nose and stop mouth breathing. The other alternative is obviously in CPAP to use a full face mask that covers your nose and mouth. So these masks are much bigger. And that would overcome the problem of patients with severe sleep apnea who are also mouth breathers. But it's very interesting, this whole idea of mouth breathing, and you should read James Nestor's book. This is pretty phenomenal work of research about all the dangers of mouth breathing and how a lot of our health problems have come about from the fact that we don't breathe through our nose.
I want to say the audience is really, very engaging, very happy to see, and there's so many questions, so many more things. But I know time is a problem here. So what I can suggest is I can ask everybody who has question to send to us, and then I will probably compile them and then send it over to you, Dr. Jeeve, and have everything, as many answered, because I don't think we'll be able to cover everything. There are questions, some of them clinical, and if I think it's better to have them, compile them, and send it over to you. And we'll like to answer everybody who has a question today. We'll try to answer everything within this week. So please, sorry we could not take everything. Dr. Jeeve has an appointment. But thank you for this. I think seeing so many questions, and whoever has not, we've not taken that question, so we will answer that. It's just over or offline we will do that, and over email I will reply to you. So thank you again. Thank you, Dr. Jeeve. Very engaging, like always, and really it was funny, and it was also a serious situation, but the way you explain it, it's always becomes very, very engaging for me especially, and many times I have seen that. So thank you, everybody. Very good audience, I think, in between the chat that I'm seeing, and thank you for your time today. And we'll keep doing these sessions again, and Dr. Jeeve will be again helping us and talking about this to other people and even people who are here today. So thank you for your time. Thank you, Willis Tower Watsons. Thank you, everybody, and have a good day. Bye-bye.
Bye.